Good evening, and I'd like to send a very warm welcome to all of you joining us tonight. I'd especially like to thank Kidney Care UK for all their support and for us running this webinar with them, and we look forward to some very interesting questions and answers tonight. Just so you're aware, and it'll come up on the screen, but this webinar is being recorded and it will be available to see in a few days' time for those who can't join us, or if you want to review and see if it go over any of the questions again. During the webinar, please keep posting your own questions to the panelists using the question and answer button on the screen. We have had a huge amount of questions sent in already, which we'll be working our way through, but we will try and answer some additional questions as well. Just before we start, you'll notice on the bottom of your screen, beside the Q&A button, there's a chat button. I would like you, just so we can have an idea of where everybody is joining us from, if you could just type in your name and where your village, town or city where you're joining us from in the UK, so we can get an idea where everybody is joining us. That would be fantastic, thank you. We won't get through all the questions tonight. Any specific questions about your own kidney health, we advise you to speak to your own kidney doctor. Any other general questions, feel free to contact us through the email for Kidney Care UK, and we can try and respond to them, or we can find people that can answer your questions. Beside the chat function, you can upvote the questions by clicking on the thumbs next questions on the chat screen. And we ask you not to use the chat box to post the questions. Any technical issues that you have with joining, just put in the chat box. And if you get logged out of the meeting, just join again, and it should the same link will let you back in. Is there, I think that's all the housekeeping I have at the moment. And at the end of the webinar, there'll be a link for an evaluation, which we'll be very grateful for you to complete, because your feedback is very useful for the next one. And I'm delighted now to hand over to Professor Mark Clancy, who's going to be your chair for this evening, and he's going to introduce the panel. Thank you very much.
Good evening, everyone. This is a new experience for me. I have done quite a lot of these question and answer meetings in person about living donation, and it's usual that I can see you all, and I guess there possibly is more than 100 of you here tonight, and I can't see any of you, but I can see lots of names on the chat, and I look forward to answering all your questions. We've already got a large number of questions sent in advance that Jen is going to be putting to us. Just a brief little bit about me. I am a transplant surgeon, and I've been working in the Glasgow half of the Scottish National Kidney Transplant Service for the last 15 years or so. And I am just one of a huge team of people behind that program. And there's a whole sister program based in Edinburgh covering the east side of the country. And we have a large group of colleagues gathered together tonight for the panel, and I will introduce you to them one by one, and then each of them in turn is going to tell you a little bit more about themselves. So I'm going to start off with my colleague Julie Glenn, who is a living donor transplant coordinator based in the West of Scotland unit.
Hi everybody, I'm Julie. I am very proud to be part of Mr. Clancy's team here in Glasgow. I've been working in this job for the last 8 years now, and prior to that I worked in the transplant unit as a member of the nursing team there. So hopefully I will be able to answer any questions that you might have on the living donor process. Thank you.
Now, from the Edinburgh side of the transplant team, I have got one of my consultant nephrology colleagues, Lorna Henderson, who's a specialist in kidney transplantation and in modifying the immune system to help kidney transplants work. Lorna. Are you there, Lorna?
Lorna, you're muted.
First one to do it this evening, I'm so ashamed. Yes, hello everyone. Really looking forward to this evening. It's the first time, like Mark, I've participated in a panel session online, and already I've displayed my IT skills are not top notch. I'm a consultant nephrologist. I'm based in the Royal Infirmary of Edinburgh. I've worked there for a number of years, but as a consultant, I've been there for the last 8 years. I'm largely involved in the transplant side of things. A big part of my job is looking after people who've received transplants, but part of my role is also meeting people who are coming forward about living kidney donation. And my particular role is to meet individuals who are coming forward for their sort of early stages of investigations and sort of assessing them from a medical perspective. But I am part of a bigger team like Mark in Edinburgh, part of a group of consultants, surgeons, nephrologists, anaesthetists, coordinators, and as part of our team, we help assess the people who are coming forward regarding suitability for donation. So happy to take your questions this evening.
Thanks, Lorna. The next colleague from the clinical service that I'd like you to introduce you to is Orla Hobson. Now, her title is a REACH nurse, which stands for Renal Education and Choices at Home, which is an interesting, very effective new innovation in transplant care. And Orla, I'm sure you'd like to expand on that for everyone tonight.
Thanks, Mark. Hi, everybody. My name is Orla. My background is in renal nursing. So I worked on the renal wards in Edinburgh for a number of years. But as Mark said, I've been involved more closely with the transplant team recently. We've been trialing a home education program called, as Mark tells you, Renal Education and Choices at Home. So when a patient, when somebody's nephrologist thinks that they might need a transplant in the future, my job is to come out and to see that person at home, along with whatever friends, family who want to be there, to just do a very informal education session about kidneys, about what happens when they go wrong, about the various treatment options, the benefits of transplant, preemptive transplant, live donor transplant, and all the various alternatives. Very happy to take questions this evening.
Thanks, Orla. Now the most important people on the panel, and that is people who have been patients themselves and have experienced transplantation and living donation from the side that you'll be interested in. I'll start off with Ewan McLean. An official title is Lead Advocacy Officer for Kidney Care UK, and also currently chair of the Scottish Kidney Federation, but most importantly, a renal patient himself. Ewan.
Thank you, Mark. My name is Ewan McLean. As Mark alludes to, I've been a patient for 34 years and had 2 successful transplants over these years, one about 30 years ago and another 5 years ago last Saturday. I've worked with kidney care in my position for about 10 years, and it's been an absolute pleasure to serve the renal community and their families over that time. Thank you.
And I'd also like to introduce you to and welcome Chris and John Kelso. John and Chris are brothers, and 5.5 years ago in our unit, John donated his kidney to his brother. And I think it's fair to say that that's been successful, but I think John and Chris can tell you far more about themselves and about their experiences than I can. So John and Chris.
Okay, I'll go first then, seeing as I'm the oldest. John Kelso, I live in Glasgow. Probably about 6.5 years ago now, I was very fortunate to meet Julie Glenn, who's on the panel tonight, who made the whole process extremely straightforward, very easy, very comfortable for us individually and as a family. Also dealt with Professor Clancy as well, who I believe was the one who removed my kidney. You might be able to clarify that. Yeah, I was very lucky enough to have one of these sessions, not in a webinar, but live meeting with other people who had been through the process and others like us at the time who were going through the process. Made it very, very comfortable for us. Made me, or confirmed to me, I was making the 100% the correct decision. Since then, I've been to a couple of similar meetings that we've done face-to-face with people again in the same position. So again, if there's anything I can do and answer to anyone tonight to put their mind at ease, then I'm more than happy to do that, because it certainly was a very good help for me.
Thanks, John. Chris.
Hi there, my name's Chris, and I've been a renal patient for just over 40 years. And as John mentioned, it was 5.5 years ago that I received the transplant from John. And again, I think we're at this stage now here to speak about the fact how our life has changed, or how my life has changed, certainly in that time, and the fact that, you know, the kind of the life that I had before that I wasn't able to participate in. I'm back doing a lot more things, a lot more active than I used to be as well. So yeah, I'm happy to talk to anyone and answer any questions as well, just to prove that, you know, receiving that live donation from John has completely changed my life. So yeah, happy to answer any questions that may come along.
Jen, I don't think I need to give you a formal introduction again, do I, Jen? I think everybody knows you now.
Thanks very much. Thank you. I'm Jen Lumsey, a lead nurse for Living Donation Scotland, and I'm question master tonight, and will be putting the questions to Mark, who will distribute them amongst the panel as he sees fit. So as I said earlier, you know, with fantastic questions, a huge amount of questions come in. We won't get through them all, but what I've tried to do is there's something quite similar. So we've tried to clump them together to make sure we can answer as many of your general queries as possible. And the first one is about preemptive transplantation, to ask the panel about their views on preemptive transplantation. Over to you, Mark. Thank you.
This is a great point, because basically the really difficult questions are the ones I can't answer. I can throw somebody right under the bus. And I suspect we'll all have different views on preemptive transplantation. I think it's highly desirable, if possible. In general, when you're taking care of patients, you want to keep them well rather than to have to pull them back from a state of being unwell towards wellness. And that's really what a preemptive transplant does. It stops the deterioration that can happen to people and their life quality over a prolonged period of time on dialysis. Now, that's not to say dialysis is a bad thing, it's a great thing. And it's not to say that transplantation after dialysis is a bad thing, it isn't, it's a great thing. But probably the best thing you can do to keep yourself healthy is, if you have a kidney problem that's progressive, is to have a transplant before you need dialysis. That's a preemptive transplant, and stay well rather than to deteriorate and then try and get the benefits of transplant afterwards. So that's my view on it. I think it's a great thing and we pursue it. It's not the be all and end all. Transplant is still great if you've already gone on to dialysis, and the benefits are very, very large and substantial. I suppose, Lorna, do you want to expand on your views on that?
Yes, I would absolutely agree with you. I wasn't sure what the kind of the flavour of the question was, and presumably it's like, is it beneficial to have a preemptive transplant, or what are the specific benefits? But I think absolutely, in terms of quality of life and your general health, if somebody is fortunate enough to be able to proceed with a live donor transplant, then that would be ideal. I think as a nephrologist, increasingly, and actually this is where Orla comes in as well, as I start to think about introducing the idea of transplantation, when someone's kidney function is approaching about, well, depends on how you interpret it, 20%, or you're between stage 4 and stage 5, ideally stage 4, when you know that somebody is going to need renal support at some point in their lifetime. And the sooner you think about transplant assessment and approaching people about living donation, there's a greater chance that you might find or be able to achieve a preemptive transplant. I think there's sometimes a downside of perhaps starting a little bit too early. You want to be able to get on with your life and not think about what's happening in the future too much. But I think there's a much greater chance of finding a suitable donor and having a preemptive transplant if you start at an earlier stage. Again, it's not always possible for everyone, and things, or sometimes kidney function deteriorates fairly quickly, or sometimes we meet people who actually need to start dialysis at the time that we meet them. And absolutely, in that case, a transplant after a period of dialysis is also fine. But I'm a big supporter of preemptive transplantation.
Chris, forgive me, I don't recall whether your transplant was preemptive. It's 5 years ago now. I think it was. Do you want to speak to that?
Yeah, absolutely. I felt very fortunate. To be honest, the fact that I was able to, before going on dialysis, I was able to go through the process. It allowed me to maintain a certain standard of life. I worked normally right up to the transplant. You know, everything was very, you know, normal. Obviously, there was fatigue and there was other things like that that was taking its toll, but I didn't have that commitment of going and, you know, having to get dialysis 3-4 times a week. So I felt very lucky and very fortunate that the transition for me was quite seamless, and I certainly maintained a good level of life, standard of life, certainly before and after the transplant.
I suppose, do we move on, Jen, or do you think there's more to say around Preemptive?
Yeah, no, I think that's great, if that's okay. Happy for the next question. Yeah. I'm booked for a live donor transplant in 2 weeks' time and wondering what people wished they had known prior to the operation. That's a great question.
Okay, well, that one really, I think we can say, Ewan and Chris, perhaps you can answer what you wish you'd known before you went through transplantation.
I think the one thing I wish I'd known was that I was going to be pumped full of steroids and not been able to sleep for the first few days after the transplant. I've never spent such an active time, mindfully active, as I did after my transplant on both occasions. I wasn't aware that that was the kind of protocols. And I think if I'd known about that in advance, I'd have handled it a bit better and not have been so grumpy as I was.
Chris?
Personally, I felt very well prepared, but kind of on Ewan's point, I was told that you're going to get these steroids and you're probably going to be, you know, way up the day after. And for me, I didn't notice any difference. It was all everyone that was coming to see me that was saying, "Wow, you were off the chart yesterday," you know. But honestly, going through the process, for the amount of time that went through the process and the meetings that we had, I genuinely felt very much, you know, I had everything, all the information that I needed was provided. And I really didn't feel as if there was anything that came out of the blue or anything that you know, I wish I would have known, to be perfectly honest with you. I thought the whole process was done remarkably well.
I would take the view that it's a mind-blowingly complex series of events at the time of a transplant. And you and Chris have highlighted one side effect to one of what may be 10 or a dozen new drugs that you might receive around the time of that. There are so many different things that can happen. There are so many intrinsic parts of the process and changes happening in a very, very short time. You cannot possibly predict everything. But I encourage patients strongly to educate themselves. We provide information, leaflets, and then a handbook in the west of Scotland that's got a lot of information in it. But there's a whole world of information about kidney transplantation on the internet and on other sources from the charity, etc. The more you know, the less can come as a nasty surprise to you. But equally, the other side of that is the more you read, sometimes the more worried and stressed people get. So it's a balance to find. There'll be something that surprises you in your transplant process. There'll be something that blindsides you. It's inevitable. But maybe listen to the testimony of the people who've been through it and are living the benefit of it and take comfort and have faith in that.
Well, just one other thing, and again, it was something I was well prepped on, but your tablet management afterwards I felt extremely important. You know, it's getting into that routine and make sure that you always have enough up front. You know, you're not leaving it to the last minute. It's not something you want to, you want to kind of play about with. You're dealing with something that you're going to be taking for the rest of your life, which, you know, it's a small price to pay. But I think just making sure you have your tablets, you've got them all kind of in boxes, so you're ready to take them at the allocated time. It was just probably one bit of advice just to anyone that's going to go through it. That's a very important part of it, and you don't ever want to put yourself in the position where you don't have a tablet, or you might be in a position like that. So I think just tablet management would be something to focus on as well afterwards.
Perhaps one more shock that came to me first time around 30 years ago was that for those that have been on dialysis, you'll know that you stop urine production. And to be told as you're coming round from the transplant that you're literally peed on the table, on the operating table, and then you've got that urge again to go to the loo. It seems trite, but it was a glorious feeling. Yeah.
Yeah, that's a good thing. But was it a glorious feeling when you had to go every hour through the night because your bladder was front of it? It's another thing that can happen if you haven't passed urine for many years. Should we move on, Jen?
Yep, thank you very much. So there's a number of questions, unsurprisingly, about COVID-19 and the impact upon dialysis patients, renal patients and transplant. And one of the questions was, does a live donor transplant change the COVID-19 death rate risk for a recipient?
Compared with dialysis, it probably improves it based on the data that we have. But having major surgery would be a very bad time to get COVID-19, going through an operation, etc. That would be a period of increased risk. However, now, as we stand today, pretty much everyone who will be coming forward for this will be double immunized. The vast majority of such patients will have really good protection and are unlikely to get severely ill from it. And currently, despite the Delta variant, the overall prevalence is much lower than it has been. So that's not something I would be lying awake at night worrying about. Would you have, Lorna, any other views on that?
No, I mean, I think it's clearly a question that it preys in everyone's mind, and particularly in the last year when there was a great deal of uncertainty about risk and planning for live donor transplants and trying to do that safely in the context of varying rates of the virus. And I agree. I mean, I think the fact that the majority of people now, either dialysis patients or transplant patients, should have received both vaccines, will offer some level of protection. I think there's also some work at the moment looking into what that level of protection will be compared to people who are, for instance, not on immunosuppression. And that's something we would probably be able to answer better in the next few months. But I think in answer to the specific question about is your risk less in terms of being more unwell with COVID if you've received a renal transplant versus transplantation, possibly yes. I think the difference is it also will depend on other things. If you are somebody who is older, perhaps who's on immunosuppression, older on transplant, your risk might be higher than somebody who's younger. So specifically, if you are on immunosuppression versus not, there's not such strong evidence to suggest that's putting you at increased risk. I think there's lots of other things that come into play, which is why I think the team that would be looking after you would be having these discussions with you closer to the time to help guide you to make those decisions.
Okay.
Thank you very much. So, and to follow on from that as well, I've been approved as a living donor for my father. My test process started in March 2020. What sort of delays is COVID causing for the living donor programme?
So I thought I would bring in John. And how long did the process take in the past? I think perhaps you can give a guide of how it did work.
I believe it was maybe 9 to 12 months. I think it was. Maybe Julie might be able to keep me right on that. But I certainly remember it was a process round about the year mark, possibly 9 months. A very straightforward process, easy. You know, it basically gave me it was like an MOT for myself prior to doing it, which gave me a lot of peace of mind that I was healthy enough to go through the process. But in terms of time, I would say probably 9 months, maybe a year. But possibly Julie might correct me on that. But as I say, that was just over 5 years ago now, so the memory's going.
To you shortly, Jules. But both colleagues in Edinburgh and in Glasgow, we're working very, very hard to streamline this process in many ways. And a year to me is far too long, ideally. Sometimes it's necessary for various reasons to take further time. Where would you say we're at now, Jules, in the kind of early tail end of COVID era?
I think if you've got a donor who is quite straightforward and has the time to commit to the process and is flexible with that, we can certainly work somebody up within about 4 months to be ready for surgery. Obviously, a lot of that then depends on where the recipient's at, and sometimes there are delays because it might just not be quite the right time for the recipient. So there's lots of factors that contribute to the length of time a workup process takes, but we're pretty slick with it. Wee bit faster than back in your day, John.
Ola, are you where are you at with things at currently?
So the coordinated colleagues who are doing the assessments, I think are similar to Julie. It depends on the complexity of the donor, and it depends on where the recipient is in their process as well. It's a lot of moving parts, but I think ideally, we should be able to work up a straightforward donor in about 4 months. But in reality, it often takes a lot longer than that. And I think that's one of the key reasons why, if somebody is interested in being assessed as a potential donor, it's almost never too early to be kind of getting your ducks in a row about that in terms of submitting at least the initial paperwork. If it is too soon, you will be told that, but it can take a long time.
And I think I would add a more broader view that I think COVID has caused enormous problems for the health service as a whole. All the organizations are under great strain across multiple avenues. 15 months of elective surgery has been set back, clinic appointments set back, lots of staff absences now, and the system is under great strain currently, more than at any stage ever in my nearly 30-year career. And that is a difficult environment in which to be as slick as we like to be. And I actually think in transplantation, we're relatively preserved from it for various reasons, relatively protected from that, but not completely. And things do not work quite as smoothly or as slickly as we would wish. And it'll be some time before it does.
And I think particularly if there is an investigation that a particular donor needs because of their own past medical history, if the transplant team are then referring to another speciality, those specialities are often very keen to help, but they've got a list as long as their arm of unwell people to assess. So they're triaging these, by default, very healthy people beneath the who are kind of at the bottom of the pile, unfortunately. So it makes that process a little bit longer than it ideally should be.
Jen, did you want to come in on that? Did you want to add something further on that, Jen? Or
that's great. Thank you very much. And moving on to the kidney sharing scheme, and that maybe just to add that, the kidney sharing scheme obviously last year was impacted because of COVID, so that has caused delays for people who are waiting for living donor transplant as well. And the next question is, do donors generally mind entering the kidney sharing scheme if they're unable to donate to their partner, friend and relative? So we can maybe incorporate these two points. Thank you.
Yeah. Jules?
I think it's a very personal decision for a donor, and we do have donors who just don't feel comfortable with it, but on the whole, I would say it's a very positive thing for people, and they're usually very, very engaged with the process. The assessment process for a donor is the same regardless of whether you're donating directly to your loved one or whether you're donating through the sharing scheme. So the number of tests, the process is exactly the same, and the end result is the same in that the person that you want to be transplanted gets transplanted. There's obviously some complexities around that through the sharing scheme, and it might not always happen in the timescale that you want, but generally it's a very positive experience. And I think it's really important to note that a lot of people now go into the sharing scheme who are compatible because they might be looking to try and get a better matched kidney or a kidney with simpler anatomy. So the sharing scheme is becoming the norm, I would say, and that benefits everybody who is joining that scheme.
Lorna, has that been your experience also, increase in perhaps even compatible donor pairs who could have donated directly, choosing to go into the paired pool scheme?
I think that's something that we're seeing a change in. I think probably at the moment it's still our incompatible pairs that are being entered into the kidney sharing scheme, but there is a move towards that. And I think we're seeing also that there are more transplants happening as a result of compatible pairs entering the kidney sharing scheme. So it's having a beneficial effect, not just for the person you're helping, but for others who are in a similar situation in the UK. And I think in terms of the actual question that we were asked, I think occasionally there may be a few individuals who feel that they would like to donate to the person that they know, and not to anyone else. But actually that's pretty rare. As Julie's kind of explained very well, that you are still helping the person that you want to help by coming forward. And although the timing might be slightly different, the ultimate aim is still achieved. So.
Okay.
Thank you. Lovely. Now, there's a question come up. There's questions coming up in the question and answer bar as well, so there's a general one about the real risk for live donors, and if there's a higher rate of average of the donor developing diabetes following donation, if there's any family history.
Again, Lorna, forgive me for picking on you, but that's probably your particular expertise. So
I'm not aware of any data that would support that by donating a kidney you're at greater risk of developing type 2 diabetes. I think it's fair to say probably with most centres we have a similar approach in Edinburgh, where if a potential donor does have a family history of type 2 diabetes, that for anyone who comes forward, we'll check blood sugars and take a careful history from them. But if they have a family history of type 2 diabetes, we may do slightly more detailed tests to kind of, if you like, sort of put you under a bit of stress to see how your body responds, a thing called a glucose tolerance test occasionally, which would tell you with greater certainty if somebody is on the brink of potentially or higher risk of developing diabetes. So I think, our assessment process is very rigorous. I think we were hearing earlier, John says you go through a bit of an MOT, and you absolutely do. And I think, in terms of by donating specifically, I don't think you're going to be at high risk of diabetes. I think one thing that is very important is your lifestyle. And, when people come forward, sometimes they may have to lose some weight in order to donate. They may have a history of smoking, or they continue to smoke. These things will continue to put you at risk, as they do with anyone, whether they've got 1 or 2 kidneys in the future, of developing things like high blood pressure, or if you gain a lot of weight, type 2 diabetes. So in many ways, some of the people who come forward for assessment feel that it's given them a real impetus to change their lifestyle and feel better for it and maintain that after donations. So, I think it's still a positive thing. But yeah, by donating itself, I don't think you're at higher risk of developing diabetes.
But it's the kind of thing, I think, Lorna, it's fair to say that we consider, and the long-term likelihood is determined, as you say, more than anything by the lifestyle factors that you choose as an individual. And if it's crystal clear that your lifestyle choices are leading you down that road, and that's not changing, then it's probably not appropriate to donate a kidney, because you're putting yourself at greater inevitable risk. But that's a judgment, and that's not a judgment that's fixed in time. That's something that any individual has the capacity to change. I suppose, John, did you recall from your counselling, you're a relatively young and fit donor, but these kind of issues were considered in your workup? You're on mute, John.
I thought I pressed it there, sorry. Yeah, it was all explained to me, very early on. Julie explained the whole process, made it crystal clear, so we knew exactly what we were doing as a decision as a family. I was fit and healthy at the time, made sure I was fit and healthy leading up to it for kind of post donation, that I was maybe going to be able to recover better from the operation itself as well, and thereafter continued a fit and active life. So in terms of all the processes leading up to it and keeping fit and healthy, yeah, it was I wanted to make sure it was important first and foremost that the kidney that I was donating was going to be fit, fit and healthy to be donated, and obviously the one that was going to be left with me was going to be suitable for me to keep me fit and healthy afterwards. So I think, as you said earlier, I think it's down to the individual and how you look after yourself prior to and after it to ensure that everyone's fit and healthy at the end of the process. I don't know if that answers your question or if you're looking for something. Yeah.
Thank you very much. Next question is, I would like to donate, but I don't think I can.
Oh, you're frozen, Jen.
Is there any support in my case?
Sorry, you froze there. I didn't catch that question. I don't know that everybody else did.
Sorry. I'd like to donate, but I don't think I can due to my family and work circumstance. Is there any support to be done for my case? Did you manage to hear that?
I did, yes, thank you. Yes. Julie, that's a difficult situation, isn't it? What do you think?
I mean, I think for anybody donating, it has to be the right time for you, but certainly your coordinators would probably be a good starting point to chat to them about it, and they would certainly be able to give you support, hopefully, in coming up with a decision as to what's right for you. You know, we always encourage everybody to speak to family members, and it's important that your family are on board with you donating as well. So if there is a lot going on in the background, then you know, it might be that it's not quite the right time for you, but there certainly would be support through your coordinators. There would be support through somebody like you and in Kidney Care UK as well, if, you know, if you wanted to chat to people independently about it.
And it's not a failure if you can't, if it's not suitable time to be a kidney donor. It's not a failure if you put yourself forward. You can only volunteer to be a kidney donor, and probably what, 6 out of 7 people who volunteer don't go all the way through to donating, maybe slightly less, but it's the vast majority. And your offer is no less for that. And it's, I hate to think of people thinking that that's somehow a failure. And I think we need to kind of get away from that as much as possible. We're always glad when people come forward, and there's no certainty or assumption around that. We take you as far as we can take you, and if it's not right, then we don't take you any further for your own benefit or for the benefit of other stakeholders. That's part of what we do, and we consider whether it's the right time for every individual. It's important in the minds of the nurses and doctors looking after you.
Can I just add that you know, a recipient would be active on the deceased donor waiting list as well. And, you know, as much as we're all here to promote and advocate living donation, we still transplant more people from deceased donors in the UK than we do from living donors. So there is always that option there. And we spoke very much about preemptive transplant being the gold standard, but actually, you know, if it comes at a later time for that recipient, then that's not a failure by any means. It's got to be the right time for the donor, for the donor's family, or else it's not going to work out. You know, it's important that you're ready for it, because as John says, you've got to be fit and healthy and ready for this, and that's emotionally as well as physically.
And it's probably, I'll just add in as well that there is a scheme for reimbursement for loss of earnings if people are self-employed, and you know, so that shouldn't be a barrier to people going ahead if they think they're going to lose out on income. That there is mechanisms in place, but you know, there's the broader picture to look at. You, from the advocacy point of view.
Yeah, we regularly get calls to advocacy to help and advise on this matter. But in addition to that, Kidney Care offer a counselling service. It's a telephone counselling service with trained renal counsellors, and they can talk them through any difficulties they might perceive. But the other thing that's open to us is if we have a donor, a possible donor comes to us looking for advice, we can usually manage to team them up and allow them to meet, if it's COVID safe, to meet with someone who's already been in that situation both the donor and the recipient. And they report back to me that they get more answers in that hour session than they do from anywhere else. And it's always gratifying to hear them coming back. That session with a patient and a donor actually made up their mind for them. Yeah.
Thank you very much. Thank you. Next question. During this pandemic, if the donor is from a red list country, but happy to pay all the costs, then can we allow them to come here? Over to you. I think the cost should come out of it because we would reimburse travel, but I'm not sure the situation at the moment with the red list country.
My understanding is that a red list country is banned and excluded from coming into the country just now, and that might be applicable to somebody from an amber list country. But for a red list country, that's a no. Is my understanding, Lorna? What do you think?
Yeah, I agree. I mean, I think the only thing to say is things change so quickly. So whilst this might not be possible now, that might be a very different situation at a later date in a few months' time. I know it's very difficult because there's such a state of flux. It's hard to plan for many things, but I agree. I don't think that would be possible at the moment.
Paula?
Say that unless this donor has already gone some way in the process, many of the initial investigations and paperwork would be done at the kind of country of origin anyway, and so there's still scope to get the ball rolling, just without the travel aspect, which might not be necessary for a good number of months, possibly years.
Yeah, that's a really important point. So such a donor could be progressed in their workup, although at present couldn't come into the country, and that is likely to change as the demographics of COVID change.
The transplant coordinators are well experienced at dealing with the assessment teams in other countries to progress donors overseas.
I'm just going to flip back to some of the questions that are coming up live, and they all seem to be targeted towards John, the donor. One, did you wish that you'd known anything in advance, and how quickly does a donor recover?
Again, I'm harking back to Julie. Julie was excellent. She kept us all as a family well updated on the process. I was very relaxed about the whole thing. Leading up to it, yeah, I was very relaxed about it. It was had been taken down to the theatre in the morning, and someone brought in a live donor box into the way I was in the bed lying next to where I was, and I looked at it and thought, oh, someone's got a live donor box but next to them, and it was me, obviously for me. So that was when it really hit me properly. And again, I was still actually relaxed about it. Recovery time, yeah, very quickly. I was trying to get fit back again, out doing some hill walking with Chris, both of us trying to get fit. So in terms of back on your feet, yeah, it was a couple of days. I think the next day actually I was told to get out of my bed and start getting myself back on my feet again, to go and get myself showered, etc. whilst in the hospital. And once they were happy to have me released, I was back home again. And obviously just apart from stitches, scars, etc., that was the only real healing issues that I had, which wasn't an issue. It was really just obviously any other operation you have to recover from that. But in terms of the kidney itself, yeah, I was back to complete 100% normal life very, very quickly. So yeah, in terms of leading up to it, I was very relaxed, and afterwards it was a very straightforward process for me. So yeah, I would do it again if I could, but I can't. I've only got one left. So.
I think that's what we're aiming for, and that's the story for the vast majority of patients going through donation. There are complications of various degrees of severity that can occur, and smaller numbers of patients have longer stays or a longer recovery time. But the vast majority of patients who go through living kidney donation will tell a very similar story to John.
Thank you. The next question is about vaccinations. Do they work as well for people on dialysis and having had transplants? Is there ongoing research into this?
I'm certain Lorna will be right up to date on that.
I thought I tried to answer that a little bit earlier on. I think it's a bit of a cop-out answer. So there is research going on to this. We're looking at this and there's data being collected. I think I can't give you an absolute clear answer on that just at the moment. I think it's a very important question to ask, clearly. I think that we know when we look at how we vaccinate or use other vaccinations in people who are, for instance, on dialysis, that sometimes we might not see such a strong response, but we see a response and it protects people. So if I was to hazard an educated guess, I think this is what we'll see with the COVID vaccination. But I think to be able to answer that question fully, we probably need a few more, maybe not even months actually, but it is being looked at. I'm not sure if that's, yeah, I mean, because I think sometimes I have seen some of my patients who've been transplanted have asked that question. I'm not sure if you've come across this, Mark, but I was almost a bit surprised when a few people were anxious about being vaccinated because they were worried that this might actually interfere with their immune system and potentially cause problems within the transplant, perhaps cause rejection within the transplant. It's certainly not something that has been described. I would absolutely advocate that everyone should be vaccinated and to get protected. But that level of protection and how much you'll be protected compared to people who are, for instance, not on dialysis or on immunosuppression, we probably have to wait a little bit longer to answer that, but people are definitely looking at it.
I think that's a question to absolutely answer accurately needs a lot of scientific rigor and careful study. But very crudely, I can tell you that we are not being inundated with large numbers of patients who have had the vaccine, but it hasn't worked because of immunosuppression. I think we are seeing a similar decrease in rates of COVID in the immunosuppressed and in the dialysis patients who are priority immunized that we are in the general population after vaccination, which is a rough indication that the vaccine has some meaningful efficacy in that group. So I would trust it and I would encourage all patients to have it.
Thank you very much. Thank you. And the next question is, why do kidney patients find it difficult to raise the subject of living donation with their family and friends?
Well, you obviously didn't, Chris. And that's, perhaps you could speak to that.
Yeah, sure, no problem. I struggled personally. I think for me, it was something that I had dealt with all my life, and it was my thing. Not really understanding that your family are part of that as well. But I went to the hospital appointments and I did everything else. But then it was Mr. Kingsmore spoke to me, and that's when I first met Julie. And he basically told me I have to. You know, he said, this needs to happen. You need to have this conversation. And even then I was very reluctant, you know, and it was just more of a in passing, speaking to John and my mum and whoever is just like, oh yeah, that's what that appointment was about. They're now kind of moving on to this next stage. So I didn't really ask. It was me just pointing out and saying, this is the kind of stage I'm at, and I'm going to go on the deceased donors list and all these kind of things. And everyone just put their hand up, you know. So it wasn't something that I had to ask, or I did ask. It was just the fact that my family were obviously all very sort of forthcoming and wanted to do it. So yeah, it's a tough one, and I'd struggle to ask, you know, and I do get it because it is your thing and it is a thing that you deal with, and to all of a sudden lose that control and have to ask someone else, I did find it difficult. But it was just down to my family being who they are and offered, and that was it.
And Orla, I guess a key part of the initiative you're heading is to try and address these kind of barriers. Absolutely,
thanks. And that's great to hear that, Chris, that your family were really open about these things, and the situation that you're in, that sort of your whole family were aware for a very long time about, you know, what was going on with your kidneys and how serious it was. And I go to see a really wide range of patients. You know, for some people this is very, very new, and some people it's been kind of rumbling on for a few years and it's now sort of coming to a head. But a lot of those patients, like yourself, look entirely well, feel entirely well, even though they might only have a kidney function of about, you know, 15%. they feel entirely well, they look entirely well, they've got an entirely normal lifestyle, they're working, they're looking after their families. And although they can believe what they're being told, they know that their clinicians aren't lying to them. It's just almost impossible for them to match what they're hearing with how they feel in themselves. So it's, if they can't really believe it themselves, how can they broadcast it to their loved ones? You know, and how can their loved ones really understand how serious things are for them if they're not sitting in the appointment when the doctor's kind of saying this, you know, your kidneys are only working at 15%. We're going to need to look at treatment options like dialysis and transplant. And it's very hard for them to then kind of go, yeah, I know everything looks good and I'm on some blood pressure tablets, but actually it's something really quite dramatic that is going to need to happen in the next couple of years. Oh, and would you mind, how about one of those lovely kidneys that you've got? So it's very, very difficult. And I guess the advice that we give is to try and be as open as possible. You know, if somebody asks you, how was clinic? Don't, oh, grand, end of story. Just try and use that as an opportunity to be a bit more open about things and say, well, actually, you know, I've had this thing going on. They've been keeping an eye on my bloods over the last little while. Well, the doctors are thinking that actually, rather than just tweaking things with my diet and medication going forward, we're going to need to start thinking about some more serious options, one of which is transplant. They reckon the best option for me would be a preemptive transplant. If there was a living donor, that would be ideal. And just to try and open up the conversation that way. But it is hard. There's absolutely no denying that. Lots of the patients I see, their family don't even know there is a problem with their kidneys. So, very difficult.
Thank you very much. Thank you. There's a question in the question bar about donating a kidney and then going on to have children after. Just any advice that you have for female donors in that regard?
So Julie, what's the kind of first line conversations you would have with young female donors who may be wanting a family in the future?
So we do have a chat about timing, and you know, we sort of open up the conversation and suggest, you know, would you prefer to have your family first before donation? Is that something that's suitable? But it's important for people to know that they can go on and have healthy pregnancies after they donate. Obviously, they require a bit of monitoring because there's a risk of preeclampsia and some of the complications. But if you get good monitoring from your midwife and your team there, then these things should all be fine. We wouldn't want them to have a pregnancy straight after donation. So I think, Mark, you would probably agree that we would want them to wait for about a year before, you know, post-donation before getting pregnant. But it's always good to have the conversation, and you know that if there's other donors, then that might be a deciding factor for somebody to maybe wait in the back burner and be a potential donor for the next time round, if you know, if timing's important. But it certainly doesn't stop you going on to have healthy pregnancies afterwards.
Yeah, I think that's the key point, is that many young females have donated and then gone on to have healthy pregnancies subsequently. There is a statistical increase in certain risks, particularly relating to high blood pressure in pregnancy and the risks associated with preeclampsia in pregnancy. And having one kidney does put an individual at a higher risk for having such severe problems, but that absolute risk remains small, and it's a consideration, but it's not an absolute barrier by any means. An important consideration, but definitely not a contraindication. Lorna, you probably see quite a lot of such patients.
Yeah, I mean, I don't think I've got much to add to what both of you have said. You know, it certainly wouldn't stop you donating. We have a number of women of childbearing age who've gone on to have children afterwards, but it's absolutely important to have the conversation to say that there is this additional thing to consider that you've just highlighted, Mark, that you might want to bear this in mind when you're making your mind up whether you want to go ahead and donate now, or indeed potentially if there are other donors perhaps being available in the future if it's something that you're less clear on. But it's all about trying to make someone aware of that. But as a team, we would certainly be happy to go ahead and move forward with living donation, providing everything else was otherwise fine.
It's kind of in these live events, you can usually gauge from people's body language whether you've successfully answered the question and what they were looking for. It's slightly more hard to judge whether we've achieved that, but if you want to give us some indication in the chat, that's useful.
There's an answer saying thank you for covering my question, so that's great. We've only got 5 minutes left, and really to kind of, there's been a lot of questions just about the process, specifically about the recovery time after donation, and just a bit about the surgery and assessment time. So I know that's a completely ridiculous demand to ask you to cover that all in the next 4 minutes, but could you just touch on some of the process and the recovery time? That'd be brilliant. Thank you.
Process starts with Orla and her colleagues at a very early stage. Perhaps you want to start the beginning.
So the process for living donors, one of the first things they'll do is fill in a very simple health check questionnaire, which you can either get from the Live Donor Coordinator team or is online at livingdonationscotland.org. You can read all the information there and then submit the health check questionnaire to the team who are looking after the recipient. If all that's looking good, then you would have a first appointment where we would do some very basic initial tests. And then I don't want to go through the whole process because we'll take up all the time. But if that looks good, there would be some more in-depth testing. Then you would see a transplant surgeon who would talk you through the whole process, give you a good poke and prod, just to check everything is in order. You would also need to see somebody called an independent assessor who makes sure all the kind of everybody is on board with what's happening, everything is being done voluntarily, and that nobody's feeling any pressure or coercion. And if everything is okay with that, then we would schedule surgery. And I've made it sound incredibly straightforward. Somebody else can speak about the surgery.
Well, why don't John? Why don't you just give the patient perspective on that pathway? You've told us the time length it took. What do you recall?
Yeah, it was quite a vigorous number of tests, as Orla said there. I've met Mr. Kingsmore, I think it was, dealt with Julie quite often, attended different hospitals for testing my heart to make sure my heart was strong enough for it, all sorts of other things, but sometimes it was a very quick process. You were at the hospital for a very quick checkup. Other times it was maybe a couple of hours you were there for various things, for maybe more in-depth testing. But yeah, very quick, straightforward, very simple process. Again, you spoke about the independent person we spoke to as well, and obviously who discussed the whole process with us to make sure you weren't being put under any pressure to do it. And then you had your date agreed, into the hospital the day before, operated on the next morning, and told to get in for a shower the next day and get back on your feet again. So yeah, it was. I think I was in hospital maybe 3 days. I was feeling a bit anxious about leaving. Obviously, you had all this care team around about you, and you felt very, very safe. I was very reluctant to leave, but they persuaded me to go home, and after that, everything basically went back to normal very, very quickly. As I said earlier, apart from scars, which is the same in any operation, those heal, and I'm back to living in exactly the same life and lifestyle that I was prior to the operation of the donation. So yeah, I would thoroughly recommend it. I know Mr. Clancy, you mentioned earlier on about sorry if I'm taking up too much time. You spoke about dialysis being a very good thing. Yes, it absolutely is. I hadn't experienced it. I attended at one of the clinics at Monklands Hospital with Christopher, and on entering the dialysis clinic, it made my mind up. And my mind was already made up, but that guaranteed me 100% I was doing the right thing. I didn't want him going through that process or having that kind of lifestyle, and I knew that he could have a proper lifestyle of having a fit and healthy kidney, as opposed to spending so much time wired up to machines. And I knew that the donation was 100% the right decision to make. And I would advise maybe other people even to go and look at a transplant, but not a dialysis clinic, and that may make up your mind as well. But yeah, I'm not saying it's a bad thing, but it made my mind up that I didn't want Chris going through that kind of life. I wanted him to have a proper life that he deserved.
Great. Thank you, John. I mean, I wouldn't add too much more details about the process. John's captured the fact that we're nice to you until the following morning, and then we help and get moving. We try and get people out of hospital within 48 hours of the surgery now, and we're getting pretty good at achieving that. It's a minimal access technique using laparoscopy, and it's been refined over a period of about 10 or 11 years, and so, you know, people get home quickly and they recover quickly. By the time you see people at 2 weeks, they're usually looking good, and by the time you see people at 6 to 8 weeks, they're back to normal mostly. And you have to be a wee bit careful to let the wound heals. I have a thing about people doing sit-ups too soon and getting hernias and bulges. You've got to be careful with that. But I think if you're sensible, the recovery should be rapid and smooth, and you should be back to your normal self before you know it. There's also a whole psychological aspect to the recovery, because you're going through something major, and that needs to be considered also.
Just one thing, if I can maybe add, just in terms of the scarring you're talking about, yeah, mine was a laparoscopic, if I'm using the right term. A lot of people don't actually believe that I've donated a kidney. I've got a lot of convincing. They don't actually think. I've got two tiny small holes and a very short scar. That
in it.
I know. But I've got a lot of convincing people who don't actually believe I've donated a kidney, because again, they expect to see some sort of shark bite scars on you, which aren't obviously there. So yeah, if anyone's concerned about that or scarring or anything afterwards, you probably wouldn't know I've donated a kidney at all. So yeah, if that's an issue for some folk, I don't know.
Thanks, John.
Thank you so much. And I think that is our time. And we have so many questions left, and I'm sorry, we could talk about living donation for the next 3 hours and still not get them through. Sorry, Mark, I'll hand back to you to wrap up.
Thank you. Well, I'd like to thank all the panelists for contributions tonight. Clearly, this isn't long enough to do it justice. I certainly would be more than happy to do a similar thing again. And I think hopefully it's been very, very useful for our audience. We don't have the usual feedback to do that, but what I would ask you all to do is to give us some feedback at the appropriate link that will appear on the slide following, and tell us what you think and what we can do better and how well it met your needs. That will be really helpful to us. Particularly want to thank patient colleagues who've taken the time to come and contribute as well. Your testimony about all this means more than ours, and it's very precious, and thank you for doing that. And I would wish you all a very good evening, and I hope all your future donation and transplants go very well.
Thank you so much. And everybody who's been attending tonight will get an email with the link for the survey. And I'd just like to echo my thanks to the panelists. You've all been fantastic, brilliant questions. And thanks so much to Kidney Care UK for the fantastic support to have this all organised. We really appreciate you. Thank you so much, everybody. Thank you.
Thank you.
Thank you.
Bye-bye.